Well, the classroom is a critical setting when it comes to recognizing and addressing anxiety and OCD challenges facing kids and teens. And over the next hour, we want to explore this setting with our guests, Doctors Lisa Coyne, Jeff Szymanski, and Fairlee Fabrett. Jeff, I know you've done a lot of work helping parents and teachers understand and address OCD and anxiety in the classroom. What did you learn through that experience about both the challenge and the opportunity that presents?
Yeah, it was interesting that project goes back to the early 2000s, and we called it OCD in the classroom back then. That predated me. And that was developed by basically a group of parents who said, my kid has OCD, they're going into the classroom, teachers don't know what's going on, and they're getting punished for their OCD behavior. We need to educate teachers. When we redeveloped it many years later, we did some focus groups and we talked with teachers and we said, hey, do you even know what OCD is? And they're like, I know what OCD is. And we said, do you see OCD in the classroom? And they're like, nope. And we say, well, do you know what anxiety looks like in kids? And they're like, yeah, we see tons of anxiety in kids. But we know from the research that they have 4 or 5 kids right now in their classroom that have OCD, right? So what we were surprised by is that teachers felt like, I know what this is, but they were reporting that they weren't seeing it. So we did this huge survey, needs assessment survey. We got over 1,000 responses from all different levels of schools, from teachers' aides to teachers to school psychologists. We got information from parents, we got information from kids, and we really took all of that information and we used that to develop that anxiety in the classroom project that's on the iocdf.org website. And again, the idea was to give basic information about what anxiety looks like. We broadened it to anxiety rather than OCD because teachers were saying what they were seeing was anxiety, right? So they would be more interested in this. But what I love about that program is that we built a bunch of PowerPoints and they're different modules. So you could go in as a teenager with OCD, or you have a brother that has OCD and you're like, I want all the kids in my class to know what OCD is and what anxiety is, what anxiety disorders are. You can go in, and this is a free access resource. You can go and give this presentation. You can just cobble together however you want these various different modules. If you're a school psychologist and you want to teach parents, if you are a teacher and you want to teach people in your community. So it's a really great, again, free resource where anyone can deliver it and anyone can be an audience. And again, it's really that education about what OCD is and isn't, and in the way that we're talking about in this webinar, what anxiety is and isn't when you need to be worried about it.
Lisa, when it comes to the classroom, what stands out to you the most in terms of what educators and parents need to know about the potential for challenges in that environment?
So one of the biggest challenges is that anxiety is wildly underdiagnosed in children and teens because it's quiet. The kids who get noticed are the kids with the disruptive behavior disorders that take up the lion's share of the attention. And so that very quiet child who's quietly doing their work in the corner, who might be suffering mightily inside, is going to get missed. So I think that that's one of the first things to notice. The second thing to notice, I think, would be, just as we have discussed anxiety and OCD as interpersonal phenomena in families, right? When you have someone who's anxious, our first impulse is usually to help them not feel anxious, to make them feel better, right? That occurs for teachers too. And so sometimes what you see is lots and lots of accommodations that are being made by teachers, not because they're doing anything wrong, just because that's what anxiety does to us all, right? However, and that might help in keeping the classroom functioning, but it also feeds the anxiety and feeds the children or the child or teen's assessment of themselves as unable to grow with or handle that anxiety. And so one thing that can be very important is for teachers to just keep their eyes out for these kinds of things. And if you have kids in your room, in your classrooms, who are identified as having OCD or anxiety, or for some reason are struggling with school, and it doesn't seem to be because they have an executive functioning deficit or something similar, to make sure you're in contact with parents to talk about these things. And certainly make friends with that child's treatment team so that there's good communication across that team so that we can best support kids and make appropriate, say, 504 plans or IEP plans that not just help them deal with anxiety in the moment, but also help them grow to become more and more capable of handling these things themselves in the classroom.
We're going to come back to those IEP plans because that's such an important part of this discussion. Fairlee, I want to bring you in and ask you what we know about how excessive anxiety impacts the ability of a student to take in and process information.
Well, hold on. Before I go there, I wanted to say, just going after what Lisa was saying, is that sometimes what happens with teachers is that they end up pushing for something like ADHD to be diagnosed instead of like really noticing the anxiety. So a lot of these kids end up, like the parents get like this pressure, unspoken pressure, sometimes by the teachers to be like, oh, like your kid is not paying attention. Maybe they need some medication, and they're not necessarily detecting the anxiety, which is, I completely agree with what Lisa was saying, that, you know, not only do they need to have their eyes peeled, but they also parents need to make sure that they bring in a good treatment team to get a thorough assessment of the kid. Like, you know, just like not just noticing how they're acting in the classroom, but collecting data of like how they're doing in other settings so they can do a real good assessment of the kid. And then you're actually able to see, is this anxiety? Because I agree, like sometimes what you end up doing might make the anxiety worse. And like, how does it impact their behavior in the classroom? I mean, imagine you are anxious and you don't want to speak up because you are fearing that they're going to say something or you're going to look like a fool. You're not going to participate. You're not going to engage in the discussion, right? Probably your relationship with your classmates is going to be impacted too because of the anxiety. Maybe you're not going to finish your homework or your classwork because you are so worried that you're going to make a mistake and you don't want to make the mistake, and you also don't want to ask because you don't want to look like you don't know because you're anxious about it. So there's like a lot of different ways in which anxiety can impact the kids' performance and relationships during school.
Jeff, just to further kind of round out this discussion, I want to bring in the notion of school refusal as well. Can you sort of define that for us and how it relates to anxiety and challenges that kids might have getting to school and staying in school?
Well, you know, it's interesting. We were talking about, you know, let's take a step back and look at like washing your hands. Why would you wash your hands? I want to get them clean. I don't want to get sick. I don't want to get deathly sick, right? We all wash our hands for different reasons. And in OCD, it could be, I don't like Lisa's qualities and I have to wash Lisa off my hands, right? The reason I'm starting there is that a behavior that looks the same can have 15 different reasons why. And so it's always important to go back and look at that. So with school refusal, it could be social anxiety. It could be perfectionism. It could be they have to take an hour shower because they're contaminated. So we're looking at, you know, this ongoing push, this ongoing struggle every morning to get the kid to school. It's about understanding the reasons why they're refusing. That's going to help you solve that problem. But don't assume. There was a comment, you know, when we talk about something like self-harm, right? Oh, you know, so I worked a lot with adults with what's called borderline personality disorder. And whenever they self-harmed, people would say, oh, they're looking for attention. And I think it's really important that when someone engages in a behavior that we take the time to understand the why. What is going on? What is driving this behavior? And to set our preconceived assumptions aside and really genuinely, curiously try to understand what's going on.
Lisa, you brought up IEPs, individualized education plans. This falls under the heading of accommodations, and it's such an important piece of this discussion. What should we know about accommodations, how they work, why they work, and what some of the setbacks might be based on those accommodations?
Mm-hmm. So when a child or adolescent is diagnosed with a particular issue, and let's keep, you know, our discussion, I guess, on anxiety and OCD for the current talk. It may be that accommodations or changes in the classroom or the way educational material is delivered may be helpful to them. Typically, with mental health issues, we would have what is called a 504 plan, right? Which would help support children who have emotional or behavioral disorders that are impacting their learning. So to get one of these and how these work, right? First, a parent would get their child assessed, and there would be a comprehensive assessment of what's going on emotionally and behaviorally. Is there an anxiety disorder or OCD, for example, present? If the answer is yes, then we look at how does that contribute to functional impairment in the classroom, right? And are there things that teachers might be able to do, or adaptations to the actual structure of the classroom, for example, where a child is seated, for example, additional services. If we have social anxiety, could it be helpful to be part of a social skills group that allows regular practice of being social and engaging in social behaviors with peers, right? Could it be being encouraged to raise one's hand in the classroom and being rewarded for that or noticed for that? How great you raised your hand today. I love that you spoke up. All of those things can become recommendations on a treatment team that includes teachers, usually the head of disability services at school, the parents, sometimes the child or adolescent, depending on their willingness to be there, often, hopefully, the outside treatment provider or the person who did the assessment, which might be the provider, it might be an outside service. So that team gets together and then they discuss, here is the plan. Here's our 504 plan. That plan has specific target behaviors also. What do we want to change here? What do we want to support? So do we want to see more speaking in the classroom, and improvement in grades, more socializing, et cetera? And usually the goals are very tightly tied to educational goals. After that plan has been in place for a specified amount of time, the team reconvenes to see, did it work? So I'll stop there and see if Fairlee or Jeff want to say a little bit more about that.
And let me ask a specific question for any of you. Are there potential downsides to accommodations? We sometimes hear that they can be controversial in the classroom.
I think if part 2 that Lisa mentioned doesn't happen, then it's a problem. You need to have a good assessment. You need to have an initial plan, and then the plan needs to be able to work, right? So if they're getting the same accommodations month after month, quarter after quarter, semester after semester, then our plan isn't working, right? So I think it's important to do accommodations, but you need to make sure that the plan you're implementing is being reviewed and the data is being reviewed and being changed to notice the kids' improvement or lack thereof.
Are public schools required to offer the accommodations?
Yes. They are.
I'm sorry, Fairlee, did you have something you wanted to add?
I can tie on what you just asked. And yes, they're required. Some parents don't know that they can actually go in and request an IEP. It's like a right that the student has, which comes after the 504. They're required. But what I wanted to say is it's hard to, because maybe the parents don't know that sometimes the schools have very good intentions and they set up these accommodations for the kids, and they're just understaffed and they don't have the resources to really follow through. So then these recommendations don't end up taking place. And sometimes the parents don't even know that this is happening. And it is hard to be obviously very engaged in your kids' education and be participating in school and also hold your job 100%. It's really hard. And it's also very important that the parents are paying attention. Is this taking place or not? Because, like maybe you don't see the progress, not because maybe the recommendations are not appropriate. Maybe it's because the school can't, or they haven't been able to follow through.
Jeff, let me ask you for some signs to watch for if you are an educator in a classroom. I know you've done a lot of work with OCD in the classroom. Some things might be masked. It might be that Johnny doesn't turn in his paper on time, and a teacher might take that to be that Johnny's not keeping up with the material, and yet there might be perfectionism involved in that. Can you kind of tease that out for us, what we should know, and specifically what a teacher who might be on the call today would want to watch for?
Yeah, I'll start, but I want Lisa and Fairlee to weigh in on this as well, because I think there are a lot of subtle things. A kid who's going to the bathroom a lot, stuck in the bathroom for long periods of time, a kid who doesn't have any friends, a kid who, when you're talking to them, seems really distracted, as though they're not that they're not wanting to listen to you, but that they're listening to something else. They're maybe doing some sort of mental compulsion. Yeah, a lot of kids that are turning things in late can be perfectionism. I didn't do it the right way. I had to, read, 3 different books before I could even start working on that paper. I have to retrace and rewrite and re-edit. Perfectionists with OCD are famous for turning in all their homework 2 weeks late, but getting A pluses, but they're really C's now because they were late, right? And that isn't that they were misbehaving or not wanting to follow the rules. It's that they are following a different set of rules. Lisa, Fairlee, what else?
I think we have to be very careful, right? Because anxiety, again, is so frequently missed. Am I coming through okay? My internet seems a little glitchy.
You are.
Okay,
Yeah.
great. So just because, for example, we have kids who are very active in the classroom, this is something that Fairlee pointed out earlier, it doesn't mean that they're not struggling with anxiety, and that might be masked by something else. We frequently hear kids might be tearful. They might be overly concerned about whether work is done. They might be putting intense pressure on themselves. They might feel like they might disappoint their parents, right? Those are subtler things that we might see. So I think that if you see any of these things, it could, it's important to ask questions, to talk to parents and find out what's going on. But don't assume just because you have a little disruptive child who gets angry and irritable, that that's not also a form of anxiety. Because remember, when we think about the body's response to a threat, it's fight or flight. So it's anxious arousal. And then when you feel like nothing else works, sometimes kids get incredibly irritable or full of rage about something. And so that also could be anxiety.
Fairlee,
And what I
you want
wanted
add
to
that?
say, yeah, I wanted to just comment on what Lisa was saying. Curiosity, right? Like it's so key. And if we encourage the teachers to not only pay attention, but ask, right? Like, and also bringing other people, like, is this happening in your class too? And then bringing the parents, is this happening at home? Like, before they get labeled, like, Lisa was saying, like, it's so harmful when a teacher starts seeing a kid as disruptive. They just, they misbehave without trying to understand what's behind the behavior. It can be so detrimental for their self-esteem and for the future that I really, like, if there's any educators in the audience, like, I want to encourage them to be curious and ask questions, and not just to the kid, but also to the PE teacher and the art teacher when they do the specials, and like bringing the parents and like try to understand and maybe encourage the parents to talk to someone before they even jump into saying this kid is blah.
Yeah, a great follow-up question came in from an attendee here. It says, I work with a teen client who has begun to miss a lot of school. She keeps saying that she's not feeling well, but we suspect that it's actually anxiety. Earlier, it was stated that anxiety can manifest physically. How often does anxiety manifest as things such as stomach cramps and headaches? Can one of you speak to the physiological response of anxiety?
I'm going to jump in and tell a quick story. Michael Tuig talks about, he's also an OCD therapist and researcher. And he had a colleague who was trying to get a study going on generalized anxiety disorder, and was going to different clinics and was hanging up signs around universities, and wasn't getting anyone to join the study. And then someone said, go to a GI specialist, gastrointestinal disorder specialist, and put these flyers in their office, and he got it all filled up, right? And what that means is that for some section of people, when they experience anxiety, it's lots of thoughts of danger, lots of worry about what ifs. It's the physiological heart racing, sweating, insomnia, stomach aches, a generalized sense of feeling unwell, lots of body tension. And again, really helping kids notice that about themselves, getting them to, again, in terms of good emotional labeling. Can you tell me more about what it's like when you have an upset stomach or when you're not feeling well? Where is it in your body? If it's a generalized, I don't feel well, is it you have a headache? Is it a stomach ache? Is it that your body doesn't? Is it that you're tired? Like, ask lots of questions. Again, you're going to hear that from all of us. Curiosity. Don't assume you know. Ask and find out, and coach them about how to add words to their experience. Throw out some theories. Is it that you don't feel well, or are you feeling a little bit anxious? How is school going? Is it stressing you out? Like, how are things going? Are you performing the way that you want to? Right? So just lots of conversation about coaching them as a parent. We want to coach and teach them how to function in the world, and part of how to do that is to understand ourselves and to turn that attention inside and to begin to make sense of all that stuff that happens inside of us. That's a skill we have to learn.
And
Lisa, a related question that came in here, I want to point toward you here, from a parent wondering how puberty and or hormones play into a tween/teen's experience of anxiety. Does anxiety usually increase during puberty for most tweens and teens?
That is such an excellent question. Thank you for the question. And I want to go back and say something about the illness question first, if that's okay.
Sure.
So it's important to understand that when kids or anyone is anxious, they are having there's three parts to anxiety: a cognitive part, an emotional part, and a physiological part. And when someone is anxious, their sympathetic nervous system is activated. And when it is activated, it is mobilizing you physically for threat. That mobilization comes with muscle tension, lightheadedness, increased heart rate, tummy upset, butterflies in your stomach, et cetera, et cetera. So I just want parents to hear this, that it may be that kids are having anxiety and they are also experiencing the physical components of anxiety, right? That's not necessarily a reason to stay home from school. In fact, we would usually encourage parents to encourage their kids to go to school, to stay, not to avoid. But I want to be careful, because an unhelpful response would be to dismiss those concerns, dismiss the child's experience of those physical symptoms. So one of the tools that parents can use to motivate and encourage children is, there are two ingredients to it, really simple. One, empathy. Whatever that child is experiencing is their truth, whether or not you agree with it, whether or not you think it's warranted, whether or not, you think it should be happening, etc. I get how anxious you are. I get your tummy is a little upset today. And second ingredient, confidence in the child's ability to handle that experience and do what they need to do. So we call that supportive parenting communication, right? I get how scared you are, and I know you're going to be okay when you go to school. I know you can handle it. Okay, back to the question. The most common age of onset for anxiety disorders and OCD is in the teen years. So well spotted, parent who asked that question. It can also occur in childhood, and typically with OCD, it is a more substantive sort of severe course of disorder when you see it happening in early childhood. So that's something to notice. But yes, there are, due to developmental changes that are happening in the adolescent brain, right? their frontal lobe is a little quieter and can't compete with sort of the emotion centers, which are loud and vying for attention, right? And this is sort of an evolutionary thing that happens in young animals because it helps them, right, humans included, to leave the home and go and find a mate and go explore their environment, right? But it also makes those emotions feel much more big and much more overwhelming. And so you see a lot of mental health issues arise around this time.
Fairlee, a question came in that's certainly in your wheelhouse. You do a lot of work with both anxiety and ADHD with kids. Viewer asks, so many young people have been diagnosed with ADHD, but now I'm wondering if some of them also have an anxiety disorder or OCD. How common is it for someone to have both?
I mean, the most recent statistic that I've been aware of is that 1 in 3 have anxiety. So 1 of 3 kids with ADHD, 1 has anxiety. Now, I do think that they're getting underdiagnosed, and we can go into why that might happen. But the reason why it's hard is because there's many symptoms or presentations that are very similar for both, and kids end up having difficulties in similar areas. And I think because it is maybe more frequently or more common to see a kid in a classroom setting and assume it's ADHD, I think that's what maybe the anxiety is not touched upon. But yeah, like there's all of these overlaps. And I don't know if that was a question, but like the overlap is not just in performance in school, it's about in their behavior in the classroom, how they're acting with other kids, how they're approaching schoolwork.
Can I add something too? It's not something that was asked, but I think it's really important. There are different patterns of comorbidity, and comorbidity means when you have more than one disorder at the same time, right? There are different patterns of comorbidity in child anxiety and OCD. So for OCD, for kids who have OCD, they're far more likely to have, if they're going to have a comorbid diagnosis, a disruptive behavioral issue. But this is the one I want people to hear. In teens with OCD, they are 6 times more likely to also experience depression compared to younger children with OCD. Okay.
Wow.
So it's really important. And so, I just want to highlight that because it can be that it's just so hard and they've struggled with OCD for so long because the average time before kids get diagnosed can be years, right? It can be years. And so they may have been struggling with this for a long time, which has caused sort of a progression of, cascading impairment across different areas. So it's important to note that. I just want to highlight that.
Jeff, a question came in from a teacher who wants some guidance in terms of helping kids with a panic attack in class.
Yeah, so I think, we want to approach that with, again, kindness and curiosity and confidence, right? So in the way that we've talked about, anxiety is a system that shows up and it can be overwhelming. And so we're going to sit with the kid and say, hey, you've got a lot of anxiety going on. Let's have a seat. Tell me what's going on. You show a lot of curiosity. We aren't going to do a ton of reassurance because the anxiety system is going to resolve itself, right? So if we're kind and we're present and we're asking questions, how much anxiety is going on right now? Where is it in your body? Let's get curious about what's going on. Let's see how it goes up and down. Is it showing you any pictures? Is it telling you anything? And you just get curious about it and you spend time with them and you say, wow, isn't it funny that bodies can get really overwhelmed sometimes? And when we sit with it with some curiosity and watch its process, we can learn something about ourselves. Like, I don't have to do anything when anxiety shows up. I can just notice it.
And I want to jump in here too, because I think that's a beautiful thing. And also, just coming from a family of teachers and having worked a lot in classrooms, it's really not it may not be feasible for teachers to do that, right? So a couple of things can be helpful. One is talk with the family, see if that child has a therapist, can they come up with a cope ahead plan for what do we do when we have a panic attack, right? Is there a safe place we can go? How do we manage it in the classroom, right? Because it will pass. Remember to use your skills or the cues that we can have. And are there things that we can do to kind of talk ourselves through this in the classroom? I think that's important. The other thing too is I just want teachers to hear this. Like, you're going to want to help if there's a child having a frank panic attack in your classroom. And if you've ever had any sort of heightened anxiety, you know that nothing goes in the middle of a panic attack, right? It's really hard to take in all that information. So the best thing that you might do is just make a space, be calm yourself, don't be very reactive, give them a space, say, what do you need, right? If they need to be in a quiet space, if they need to sit outside the classroom, that's fine for a little while. You might check on them every so often. And it really depends. But I think that, I love that the question, like, teachers always want to help. I come from a family of teachers, so I know this. And also, guys, it's not your job to fix it. So I think having just some tools, good communication with the family, and encouraging the child to, help to learn, take care of themselves through that is important. And then welcome them back, right? When they're ready to come back, great. No big deal. On with our day.
Lisa, you just mentioned the role of communication in all of this. Let's talk about the team approach to helping kids who are struggling in the classroom. You've got the parents, you've got the educators, and you've got potentially a clinician involved in this process. How is all that best coordinated? I'll toss it out to any of you or all of you.
It's a great question. There's something I wanted to mention before, too, like when we were talking about IOPs and 504s. There are differing levels of acceptance of having a child labeled, right, for parents. Some people and some families will say, well, I don't want the teacher to know anything because I feel like I'm protecting my child, their privacy. I don't want them to know. Other parents are like, oh my gosh, tell the teacher everything so that they can accommodate left and right and that, that my child feels super safe. And neither of those are great, right? But I just want to acknowledge that this is an individual decision, and families sometimes, need a little time to think this through. And so one of the things I would say that's useful if a child is diagnosed is it helps you get access to services, right? So helps you actually talk to the school and get some accommodations for your child. The degree of detail you share is up to you and up to the clinician. I would certainly talk to your child's clinician about that. But the other thing is it gives a common language so that teachers can start to access materials like the International OCD Foundation's wonderful Anxiety in the Classroom website and start to learn more about, like, what are the things that could be helpful. So I would say that usually the communication, it's great to be an advocate for your child. And I would say make friends with your teacher, ask for help, reach out, talk to your child's clinician if you have one to get advice about how best to do that and see if you could link them up together.
Yeah, I want to just kind of broaden what we're talking about a little bit here. Anxiety, mental health, OCD, tons of stigma still. Yep. And the amount of isolation the person with lived experience has, the amount of isolation the family and the parents have around this. We don't want to label them. He isn't an anxious kid. It's all okay, right? There's something incredibly isolating and the sense of I have to fix it. Either I'm to blame because I have this disorder, or I'm to blame because I'm a bad parent, or I'm to blame because I'm not a good enough teacher. So I just wanted to go back and just emphasize what Lisa's talking about. The value of community, not just treatment teams and school teams, but you as a parent getting your own support, you as a kid or a teen, finding another teen with an anxiety disorder or OCD is incredibly healing and validating and motivating for lots of people. So I just want to just underscore what Lisa said. Don't feel like you have to do it alone. In fact, that's your worst option. Make sure you're part of a community.
Amen.
Fairlee, you referenced this earlier. We've been talking about OCD in the classroom, but of course, we're talking about kids having challenges at school more broadly. How do you support a child who seems to have social anxiety and avoids participating in school activities such as sports or other things that may involve young people that they aren't friends with? Can you speak to that broader on-campus challenge of having an anxiety disorder for a kid or a teen?
Here's where you need communication in a team, right? Because if you're trying to do this alone as a teacher, not understanding really what's going on, I feel like whatever you're attempting to do is not necessarily going to lead to change. If this is a kid that has been diagnosed with social anxiety and we understand some of the triggers that are going on and why this is hard, then I feel like with the help of the clinician, you could come up with ways to help them in the school. And it could be like, just can go from like little attempts to join a group. Sometimes they have like special lunches with the teacher and they bring in like a couple of students in the classroom to have lunch with you. And the teacher is like almost like they're helping you be more social. But I feel like in order to do that in the school, you need more information. Like you're on your own as a teacher, looking at this kid who is trying to avoid making friends or engaging in group activities is just, it's hard. I would go back and talk to the kid, go back and talk to the parents, see what's going on, get some help from more people surrounding the kid, and then implement something like that.
Jeff, let me ask you this. This is an interesting question that just came in. I'm reading here. This comes from a school adjustment counselor. One thing that the schools are challenged by is the fact that primary care physicians continue to write notes to allow anxious students to miss school for extended periods of time. Are there strategies for schools to handle this?
Yeah, this is when the parents, I think, are your best collaborators, right? What are the pros and cons of the strategy? And they might have been the ones who went to the physician and are getting these notes. But I think it's opening up that dialogue of, again, what are the pros and cons of keeping kid out of school and why? And are they getting proper treatment and support if they, a physician is saying, they're not able to come to school. Is there a medical condition that needs to be treated, right? Or is there a psychological disorder that needs to be treated? So again, I think it's opening up that communication, talking with the parents, and they might have been the ones who were encouraging the note. And then again, bringing up that idea of family accommodation. Are we doing things as teachers and as parents and as physicians that are helping the kid, or are we engaged in the avoidance strategy that's just going to continue this cycle?
Mm-hmm.
Lisa, what should we know as clinicians trying to work with a child or a teen that has anxiety in terms of what that challenge looks like in the classroom? If a client has come in, a young client has come in with these challenges, to what degree do you want, for example, their exposure projects, their exposure homework to deal with school issues?
Such a fabulous question, and I'm going to kind of break it into parts. So as Jeff described earlier, just talking about anxiety is not treatment. So what we as clinicians really need to help kids do is to bring the tools that we give children and the practices that we teach them to the places where the anxiety is impairing, right? Doesn't help you to feel better about your social anxiety if you don't go to school and practice teaching peers and being gentle with yourself as you learn how to do that, right? So that's really, really important. Along the lines of what to know, this is an interesting question, right? Because there are different cultures around who do we talk to when we do treatment and what kind of information that we get. And it shouldn't surprise folks, but might, to know that there are a lot of what we call informant discrepancies across families, like when they report on child anxiety, right? There's often a mismatch where the child will say something and the parent will disagree or will say something completely else. Both of those perceptions are valid, right? Kids are much better at reporting their own internal experiences of anxiety, but they're not great observers of their own behavior, right? They might not know how it impacts other people or know what they look like or how anxious they look or what kinds of things they're avoiding. The parents, they also might not be ready or wanting to describe that. Parents can really round that out. Similarly, what a parent or a child says to you about what's going on in the classroom may not match with what teachers are seeing. So if you really want to do your due diligence as a clinician, it is really important, especially if you're hearing there's concerns about the school environment, classroom or otherwise, talk to the teachers, just see what they see, not just academically and in the classroom, but like, how is this little one interacting with peers? So let me give you an example, right? Let's say you have a school refusing child who says their tummy hurts and they don't want to go to school because they're really afraid of being ostracized and they're anxious about what people say. Well, if you assume that's an anxiety disorder and don't ask the teacher, you might never find out if that child is experiencing significant bullying because of some social behavior that they're doing that's making them a target, right? It's really important to get data from all your sources.
Fairlee, do you want to add anything to that?
No, I think that the main message that I keep hearing from all of us is that collaboration is really important, getting everyone on the same page, because we might have the best intentions in our hearts and we might make things work worse for our kids. So I would say that and empower. And I mean, Lisa, your family's filled with teachers. Most of my friends are teachers,
right?
And I hear it all the time. It's like, we don't have the time. I'm burned out. Yep. I don't have the resources. I can't do this. And I hear it and I feel so bad even saying that, they need to have, keep a close eye and all of this, but it's just, there's no other way. There's no other way than collaborating and being on it.
Yeah, I totally agree. Can I say one more thing though, quick? Yep. I totally agree with Fairlee. And like, just to the teachers out there that are feeling like, oh my God, you're asking me to do another thing. Here's the thing. You're already working your butt off and you're working so hard. What we're saying is this will help you less work hard. It's different, but these are tools that will help you work less hard down the road. That's all I wanted to say.
That makes sense. And Jeff, you had something you wanted to add to?
Yeah, I wanted to bring a couple things together. One is that when we built the Anxiety in the Classroom program, I said we also have to have things for teachers. We all have anxiety, right? And Lisa was mentioning kind of discrepancies in reporters. Well, what is your own relationship with your own anxiety? How are you as a model for that? How are you, like, if you have difficulties with your own anxiety and you're engaging in avoidance, what does that mean when someone else's anxiety shows up, right? And so to just be thoughtful about that as well. Like if you have a mom and a dad that are giving different reports, mom and dad might have different relationships with their own anxiety, and that might be why they're giving different reports, right? I don't want my kid to be labeled, right? It might be about ambition and protection. So I think, what do we do for ourselves? How do we get our own support? The better able we are, again, the whole airplane thing, put on your own mask before you put on the other person's mask. If you're taken care of, you're going to be better at supporting others.
So many questions coming in. Let me run a few more specific ones by you. Is picking or hair pulling common? And what should people do when a young person is engaging in those behaviors?
It's a great question.
Who wants to tackle that one?
Lisa.
Okay. So we talked a little bit before about a group of disorders called the body-focused repetitive behaviors, right? And it's not an anxiety disorder per se, but similar to anxiety or OCD in particular, it involves sort of engagement in a repetitive behavior, okay? those are around the same rate, I would say, as the OCD, so 1 in 3, maybe slightly fewer than that. And it's important to distinguish between, when kids have a nervous habit of chewing their fingernails or things like that. That's a stress sensitive thing that comes and goes. That's not really impairing. That's not what we're talking about here. These kids get injured because they are pulling off parts of their skin, right? Or they're bald, or they're missing eyelashes or eyebrows and things like that. And that becomes its own issue, right? When kids feel ostracized, embarrassed about how they look, and it makes it hard for them to go to school. So these are, often we see these in the context of anxiety, right? Because they are also stress-sensitive disorders as well, but they're not the same thing. But I would say that if you're seeing those kinds of issues, right, there's a very, very there are good treatments. We call it habit reversal treatment, or another variant of that is called the comprehensive behavioral treatment, which involves teaching kids how to be aware of what they're doing, right? Because they're often picking or pulling when they're not aware. It involves getting a clear assessment of why this is happening. Is it sensory? Is there a thought that you're having that you're pulling in context? Is it an affect or an emotion? Is it a motor behavior that makes you kind of more likely to pull? Is it your posture? Or is it the place, right? And so treatment involves two pieces, really. It's teaching that awareness, teaching them to resist engaging in the behavior, but also how can we have replacement behaviors available in the context where they're most needed, so that kids can learn to access, like if they want the sensation of pulling, they can pull, a fidget or something like that. But one quick thing that parents and teachers can do is try to make it sort of a tick neutral or trick neutral environment, which means if you see picking, if you see pulling, don't have a big emotional response. Just keep it calm, right? Because being critical or pointing it out may exacerbate the stress, thereby potentially exacerbating the pulling and increasing the likelihood that the kid's going to go find another place and pull more covertly, right? So just a couple of things about that.
And bfrb.org is a great resource. It's
Yes, excellent.
The Learning Center, the Trick Learning Center, but it's now the bfrb.org, has tons of resources. Same thing, like go and educate yourself, learn more about it. There's lots of stuff on there for kids to learn more about it. And again, when you develop a community and you have access to resources and people to talk to, other kids with BFRBs talking with other kids can be really helpful.
I wanted to say one more.
Go ahead,
just
please.
one more thing about this is that I feel like as parents with a presentation like that, sometimes paying attention to it and like actually taking it seriously, it's a whole step in its own, right? Because you don't want really your kid to be struggling this much. And an example comes to mind of someone I know, their kid started to pull their eyelashes, and it took the parents quite a bit of time to be like, this is not random. This is something that needs to be addressed, and to go and ask for help. And, this is reminding me about what Jeff said before, that there's, with any of these presentations, there's a lot of shame still. So when you get to the point of like, oh, now we're ready to address the picking and pulling, I feel like we're already past one of the biggest, harder steps to take at the very beginning.
No, that's a great point, Fairlee. I think this is a really important question I just read here. What about teachers and family who don't believe that OCD is real in a child because they cannot or do not see the compulsions, for example? How do we support children in these situations?
So important. And I think it's really important. And I would send them straight to the IOCDF Anxiety in the Classroom website for education. You could send them to the Anxious Toddlers website. And I think that in general, that response to anxiety or OCD of dismissing it. Oh, that's not real. That's not a thing. It's not that. I know it looks like this, right? That is a harmful thing that will actually cause harm because it contributes to the stigma around it. It contributes to the isolation of that child. And it's, I think encouraging curiosity about this, I think we should always be learning, even if, I know the three of us panelists, like, we are always learning about the new, what haven't I seen before in this disorder and how is it presenting, right? And I think that the damage that can be done by dismissing it outright because one doesn't believe in it is far more harmful than simply being curious. And maybe you're wrong. Maybe it's nothing. Okay, at least we've done our due diligence to check.
Mm-hmm.
Specific question came in about oppositional defiant disorder. Do the symptoms of ODD ever overlap with OCD or anxiety disorders, or is it common for it to co-occur?
It's not super common, but it can co-occur. And there are some, and actually in the book that I recommended earlier by Ellie Lebowitz, Breaking Free of Child Anxiety and OCD, they do talk about how sometimes when kids are experiencing a lot of accommodation, right, from parents, etc., because parents are getting roped into the OCD. When they start to gradually pull back those accommodations, kids will amp up their behavior. And sometimes they can become oppositional, yell, break things, argue, hit, right? And so that's something that has to be included in treatment. Now, that's not the same thing as oppositional defiant disorder. That is a sustained and longstanding pattern of argumentativeness, disruptive behavior, not hurting others, but not or violating the rights of others in some ways, right? Non-compliance with rules, trying to get out of demands, things like that. That's a different disorder entirely. But I think that it's worth mentioning that sometimes behaviors that look like they should belong to that sometimes, right, can also occur as behavioral responses in OCD or anxiety.
As we continue to explore the different challenges that might present themselves on campus for teens and younger kids, athletics certainly falls under that umbrella. Performance anxiety, maybe social anxiety around team sports, for example. What should we know about that particular challenge?
I feel like that happens so much with our teens that end up in our programs. I mean, what I could say is what should we know is that if we don't pay attention to it quickly, it can get much worse, right? Like, this is how anxiety works. The more you avoid it because you're nervous, the worse the anxiety is going to get. And then it's going to get to a point where you might need a more intense intervention. A lot of the times there's a particular trigger or something that happened that started to cause this. Like maybe you were embarrassed because your performance wasn't the same. Like these teens come to mind who they were playing soccer and they were supposed to, someone was going to be watching them, and then they were so stressed out wanting to do the best they could, and they just could not do the best they could, and they basically did not do so well. And then they were very anxious to return. I would say, I guess the coach would be the person here rather than the teacher, but like engaging in conversations, trying to understand like what's going on, like what is it that is making you like avoid not the trials. Oh my gosh, what is it? Just not rehearsals. Practice? What is it when you play sports? Thank you. The practice. Like, how come are you not coming to practice? Like, what's getting in the way? I think that's important. And then the other thing is to like not let go. I think that a lot of parents, me included sometimes, like you don't want to see your kids suffer. And you're like, okay, fine, maybe just skip this one. Maybe just skip this one. And then you go back to the second one. And already inadvertently, we're making a mistake. So as a coach, as parents, be like, okay, like let's tackle this. And maybe they don't participate. Maybe they just go and don't participate. But like getting completely removed from the situation is not going to be helpful. So again, we go back to trying to understand what's going on, ask questions, get more people involved.
Yeah, and there is some research on working with elite athletes.
Mhm.
And what they found is they were asking them questions about like what drives your performance. And one group was about like, I have all these standards I set for myself and they're motivating and I strive towards them. And then there was another group that said, when I'm performing and trying to get better, I'm really preoccupied with not screwing up and not making mistakes. And then they had a group that kind of ascribed to both of them, right? Who actually had the best performance? It was the group who is focused on standards. I set my own standards. I'm motivated by my standards. I'm not really worried about mistake making. The people that had the worst performance are the people that are over focused on, oh my God, I'm going to screw this up, right? So we want to coach people to set standards. What's your personal best? How are you going to move towards that? What is that? What and how is that meaningful to you? We start to rethink mistakes as opportunities. Oh, if you made a mistake, this is called deliberate practice. Let's go and look at the mistake that we made and let's figure out 10 different ways to respond in that situation in the future, right? So we don't want to keep redoing the same thing and making the same mistake over and then berating ourselves for it, right? We want to mix up our activity and go, ooh, this is an opportunity to try something different.
I want to add to this though, too, because there's a group, and when you think about teenagers and the incredible pressure that is placed on them to be successful, to get into college, for example, if they have access to that, they put incredible pressure on themselves to be successful in all of the areas in school, but also in sports. And so I want to add to, it's great to have standards, really important. It's also important to make sure that those standards don't become perfectionistic and you push yourself beyond. So, and this is actually a pretty common presentation that we see in our clinic. Kids get so burned out that they become depressed and then they don't want to go to school because they feel like they're not enough unless they can hit these standards. So you also would want to teach how to take care of yourself, how to live a balanced life, right? How to not get too attached to, I must have this standard met, right? So that they have a skill of self-kindness, meeting themselves where they are, of being in connection with their bodies. Like maybe my body needs rest, and I can bring it right back to practice when I've recovered physically from that exertion. But anxiety can get in the way, and OCD, of sports in all sorts of different ways. So it's a great discussion.
We have time for 30 seconds each to kind of pass along closing thoughts, key takeaways from this topic, specifically about OCD and anxiety in the classroom. Jeff?
I think, it's really important for you to just get educated. It's why we have all of you that showed up to this and why we're giving you resources about books and websites. I think it's really important to educate yourself because there's a lot of misinformation about therapy. There's a lot of misinformation about anxiety and OCD. Get yourself educated. I think it's really important.
Fairlee.
I'll add to that. I agree with that. And then I'll also say that, especially when it's anxiety, not necessarily OCD, but anxiety, I feel like we can help our kids get to wherever they can go if we give them the tools and the resources. So like they're going to raise to our expectations if they have some help. I think it's better to do that than to remove all expectations, remove all requirements from their life because we want to accommodate them. I think we do better if we keep it, but we help them with therapy, with tools, with support.
And Lisa, final word to you.
I just want to say hugely heartfelt thank you, teachers who are here, because you care about this. I can't just say enough about your commitment to your students. Thank you for your curiosity. Thank you for learning. And then the last thing is there are organizations out there like the kylecares.org Foundation that are having a giant conference coming up in April for high school students. And what they do is they provide information, mental health information to teenagers who are then going to be mental health leaders in their schools. Many local high schools, I think about 600 kids from local high schools are participating. Myself and a few others will be speakers at it. So you can Google that and check that out. So thank you. Resources are out there. Keep doing your good work.
Wow. Another great session there, guys. Jeff, Lisa, Fairlee, thank you for helping us understand why it's so important to address anxiety and OCD in the classroom.